Hello and welcome to Talking AppExchange. My name is Andrew Gothelf. I'm with the AppExchange marketing team, and I'm so thrilled to be joined today by Paul Redfern from 211 San Diego. He's the Chief Financial Officer there. And we're here to talk about how 211 San Diego is benefiting from its use of Informatica. So, Paul, thank you so much for joining us today. I'm wondering if you could start by introducing yourself and telling us a little bit about what 211 San Diego is and does.
I'm Paul Redfern. I'm the Chief Financial Officer of 211. I've been with the organization a little over a decade. 211 San Diego has a mission of connecting people in need to over 6,000 resources in our community, be it social services, health services, or in some cases, disaster services. We do this in a number of different ways. One is people can call our 3-digit dialing code, 211, to speak to an agent 24 hours a day, 7 days a week, 365 days a year. People can also use our website, 211sandiego.org, to search the resource database that is available publicly. People also connect with us over social media. In 2016, we also added a Community Information Exchange. The Community Information Exchange is a platform that we use to bring together not-for-profit and community benefit organizations in all of San Diego County to more efficiently and effectively deliver services to those people that are in need. It's not only a technology platform, but it's a human network of best practices that has been going strong for 5 years.
What we want to talk a little bit about today is how you're using Informatica, but I want to first start by going back to a time before you were engaged with Informatica. What were some of the technical challenges that you were facing that led you to seek out a new solution to help with your data?
When we began in 2004, through about 2015, we, like many other 211s across the nation, had an anonymous record. This was for client confidentiality. People were sharing very personal information over the phone, and we wanted to make sure that that did not go any further than that phone call. And so people would share their needs, and we would search our database of 6,000 resources and refer them to the best resources available for that stated need. What we found, though, was not everybody that received the information about the resource took the next step, be it because of barriers of transportation or unstated needs maybe from that phone call. Some people, though, did not take that next step because they'd already shared what their situation or circumstance was with an agent from 211, and they didn't want to continue to share it again. We, with some other partners, got together and said, how can we have a shared record with consent of the client so that we can provide these services more efficiently? That was really the genesis of the Community Information Exchange. So we sought a solution whereby we could take a confidential record provided by a caller to 211 and begin to share information with other nonprofits and community benefit organizations within our community. In order to do that, however, we needed some way to take the data from our database and transmit it to other databases that might be built on different platforms. And that's when we turned to Informatica.
It's clear that you had a very specific need in mind. What about Informatica made it the right solution to help solve your challenges?
When we were creating the Community Information Exchange in 2016, there were elements that we knew that we had to have. We needed to make sure, as we were exchanging information with nonprofit partners and other community benefit organizations, that that information was secure. We had to have confidence that personal information was not being shared in a way that was unauthorized. So did our not-for-profit partners, and most especially the clients needed to have that trust that it was secure. We needed to make sure that the network was reliable. As we were starting up and as other organizations were beginning to exchange information, they needed to be sure that they could find the information that they needed in a reliable and a timely way. And Informatica allowed us to do that. Finally, we needed to make sure there was data quality, and there are no questions about the integrity of the data that was being shared. So as a nonprofit partner searched for a client, they needed to know that that information was accurate for that specific client and not somebody that maybe shared the same name. The Community Information Exchange, as it grew, Informatica has been able to support us. From the most basic, small, not-for-profit agency that might be using a data record on an Excel spreadsheet, all the way up to a large clinic that is using electronic health records. From the smallest to the largest, Informatica is able to take that data and ingest it into our Salesforce platform. Similarly, we are able to take information from our Salesforce platform and share it with the clients. We can do this through a shared client record. We can also use it for direct referrals of resources that are available to clients to meet their needs.
So Paul, let's fast forward to you actually using Informatica. Can you tell us a little bit about all the different ways in which you're using the Informatica solution?
Every day, we are receiving thousands of phone calls at 211. At the same time, other members of the Community Information Exchange are seeing or working with clients. During those times, we're updating client records on our end, and they're updating the client records on their end. Informatica is the system whereby that data is updated across all systems so that we have the most up-to-date information about our clients. Not only what their demographic information, where they live, things of that nature, but what resources are they accessing and where. We're able to put people or organizations in as care teams of our clients so that they can receive notifications across the networks by Informatica that different resources were accessed. So everybody's staying up to date on how we can collaborate to deliver more services to the clients that are in need. Additionally, as 211 receives phone calls and we provide referrals to the clients, we can also give direct referrals directly to the resources. So we can send a referral through Informatica to a partner agency to let them know that we have referred a client to their resources. This enables them to be prepared and be aware that that person is coming in so that they can more efficiently deliver services when that client arrives. Finally, we use Informatica to deduplicate information. As one can imagine, people that call 211 might also be accessing other CIE not-for-profit partners across the county. They might create a record after we've created a record. Informatica will use identifying information from the two records to make sure that we authenticate that the person is the same person, and then update the records on both ends with the most accurate information.
So it's clear that Informatica is helping in all sorts of different ways across your organization. Paul, could you tell us a little bit about some of the results and the benefits that you've seen as a result of your use of Informatica?
From when we started in 2016 with the Community Information Exchange to now, we have over 100 partners on the platform. That allows us to communicate with the largest not-for-profits and community benefit organizations across our county, serving the largest number of people possible. Through Informatica and the shared record, we are able to move from being reactive in the services we provide to being proactive and person-centered. The way that we do this is by having that shared record that all of us can access. We can identify needs and resources that are necessary for our clients over time. Rather than being an anonymous record like we were years ago, we are now at a place where not only do we have a record of who's calling 211, what resources we provide them, but we're able to give those direct referrals to over 100 partners and get feedback immediately when those resources are accessed by the client, so that we all stay informed about how the care delivery system in our community is working and where it needs to improve.
It's outstanding, Paul, to hear how Informatica is helping both people in the community and also people within the 211 San Diego organization. To go a step further, I'm wondering whether you could tell us a little bit about the partnership that's developed between your organization and the Informatica team.
When we started out with Salesforce to create our internal record-keeping system, our CRM, really, we weren't aware of anybody else that had done anything like this. So it was all started from scratch. We were trying to determine how do we keep a record that tracks the social determinants of health, the things that will impact the success of our callers in the future. Salesforce is the one that referred Informatica to us. From the beginning, Informatica stepped in to make sure that we had the architecture necessary to take information from our Salesforce CRM and communicate with the diverse record systems across our community, be it with not-for-profits or community benefit organizations. Since then, since the initial build, Informatica has always been on call to answer any of our IT questions. They have been a partner in the beginning and certainly across the growth of the Community Information Exchange.
Paul, I love to hear from the AppExchange side how our partners are forming relationships with our joint customers. That's outstanding to hear. To wrap up, I'd love to hear a little bit about how Informatica is helping the mission of 211 San Diego. With so much need out there in the world, how are you benefiting from an organizational level from your use of Informatica?
211 San Diego's mission is to connect people in need to the myriad resources that are available in our community. By moving to a community information exchange, we are able to do that more efficiently, and Informatica is a key ingredient to that success. Allowing 211 to take a record in our CRM and transmit it to another not-for-profit organization delivering the services to a client is key to be proactive and to impact lives at the highest level. Informatica is allowing 211 to perform services in new ways. This has been more apparent in the last year as the world has struggled with the COVID-19 pandemic. As resources and services have been moved to remote, telephonic, the Community Information Exchange being able to share records via the internet securely has been more imperative than ever to deliver services remotely to people in need across our community.
Well, Paul, what your organization is doing is so important. Thank you for all the help that you're providing out to the San Diego community. And thank you for joining me today to come on and talk to us a little bit about how you're using Informatica. We really appreciate it.
Thanks, Andrew.